Hi, I'm Shakeya Allen, the founder of Uterine Cancer Awareness Network. Let's face it, we all have questions we're too embarrassed to ask, especially when it comes to our bodies. Gynecologic health can be even harder to talk about. I mean, painful urination, random vaginal discharge aren't exactly subjects casually mentioned at brunch. Today, I'm partnering with GSK to hit the streets of New York City to help break the silence and raise awareness about a specific gynecologic disease on the rise, endometrial cancer, which I myself was diagnosed with in 2009. Let's break the silence, shake off the stigma, and get you the support you deserve. Ma'am, can I ask you a quick question?
No, thanks.
How do you feel about peeing in the shower? How often do you wash your bra?
I don't know, maybe once a month. Is that gross?
If it is, I'm about 2 weeks behind in laundry. Would you mind sharing something you're embarrassed to admit that you don't know?
How to fold a fitted sheet?
How paper checks work?
I don't know how to drive a stick shift.
No biggie. I don't remember how to parallel park. I can't even drive.
What's something you're embarrassed to admit you don't understand about your body?
Whether I'm in peri or full menopause.
Do you know the difference between menopause and perimenopause?
Yeah, a little.
Menopause is when you have went 12 months without a period. Perimenopause is the phase leading up to menopause.
Oh, okay.
Do you know what this body part is?
I know that's the uterus, but not sure what that specific part is called.
That is the endometrium, which is the lining of the uterus. It builds up over a course of your menstrual cycle in preparation for pregnancy. If none occurs, then it sheds during your period. But unlike your period, this part of the body does not go away after menopause. If that endometrium builds up over time, it could cause endometrial cancer. Have you ever heard of endometrial cancer?
Yes. No.
Endometrial cancer is the most common form of gynecologic cancer in the United States. There are about 62,000 new cases estimated to be diagnosed in 2025. That's more than 160 women every single day.
That's a lot of women.
Which of these could be a sign of endometrial cancer? Spotting or light vaginal bleeding after menopause, new or unusual vaginal discharge, or persistent pelvic pain?
Probably the pelvic pain?
Yes. However, that was a trick question. All three of those can be signs of endometrial cancer.
Some of those symptoms sound like menopause.
They do. That's why paying attention to symptoms matters at any age. While irregular bleeding is common during perimenopause, it should still be discussed with your doctor, though abnormal vaginal bleeding can also result from non-cancerous conditions. For any bleeding after menopause, even light spotting, you should tell your healthcare team immediately.
I didn't know that.
I think I just got humped at. Can you name a risk factor for endometrial cancer?
Family history.
Yes, family history is important, but there's other factors that increase estrogen levels, such as obesity, early first periods, and late menopause, just to name a few. Who is more at risk for endometrial cancer, you or your mom?
My mom, I guess?
Correct. Most cases are in postmenopausal women, but it can happen earlier too. I myself was diagnosed before I went through menopause, and the rates of this cancer have been increasing, including in younger women. That's why it's super important to listen to your body, because no one knows your body like you know your body.
Period.
Hey, does anyone have a coffee? Waiting too long to recognize symptoms can seriously impact outcomes. People that are diagnosed early have a 95% chance of surviving the cancer for at least 5 years. Can you guess the 5-year survival rate for those who are diagnosed with distant endometrial cancer, which means that it's spread?
40%?
Even lower.
30?
Less than 19%.
Wow.
Yes, knowing the signs and symptoms and talking to your doctor early may help you potentially be diagnosed at an earlier stage. While it may not always feel comfortable to talk about these topics, you can see why it's so important.
Wow.
So much information I didn't know. I'm so glad we stopped to chat with you.
I appreciate you guys stopping to chat. You have a wonderful day.
Glad to be here. Your hair looks good, girl.
Thank you. We all have questions we're embarrassed to ask, but when it comes to your health, there's no shame in speaking up. There's power in it. Know the signs, start the conversations, ask the questions, and most importantly, don't wait to talk to your doctor if something feels off. Speaking up could save a life.